Hi everyone. Today myself, Ireland, and Shira are going to be talking about a very well-known serial killer, Ted Bundy. In order to look at and try and understand Ted Bundy's life, we will specifically look at antisocial personality disorder and its relation to psychopathy in Ted Bundy's childhood and adulthood. We will be relating the psychoanalytic theory to Ted Bundy's behavior, and we will also be looking at attachment theory and how different parenting styles could have affected Ted Bundy's later life. So now Ireland will be talking about the life story.
All right, so who is Ted Bundy? Ted Bundy was a notorious American serial killer, rapist, and necrophiliac. He was born on November 24th, 1946, in Burlington, Vermont, and died from the electric chair on death row on January 24th, 1989. Eleanor Louise Cowell, who went by Louise, was Ted's mother. Ted's father is not 100% known, but it was either a man named Lloyd Marshall, Jack Worthington, or it might have been even his grandfather. Louise later married Johnny Bundy, and they had several other children together. She stood by Ted when he was accused of his crimes up until the point of his confession. We all know that early life attachment plays a role in later development. Well, Ted was known as his mother's secret shame because he was born out of wedlock. To hide this secret, Ted was raised as the adopted son of his grandparents and was told that his mother was actually his sister. The home that Ted was raised in was a happy working-class family. A key indicator to Ted's later events might have been his extreme fascination with knives since age 3. Ted was a smart kid and did well in school, but did not do so well with his peers. As a teenager, Ted was a peeping Tom and thought nothing of stealing things he wanted from other people. He then went on to the University of Washington and graduated with a psychology degree and was accepted to a law school in Utah. With age, Ted Bundy became very socially confident and even had a girlfriend. I will briefly explain his killing timeline, although his crimes are not the main point of this presentation. Bundy confessed to killing 36 young women, but the total is likely many more. He would lure them into his car by pretending he was injured. He would then rape them and beat them to death. Bundy was first arrested after he moved to Utah for possession of burglary tools and was then linked to the string of missing girls. The next year, he was arrested again and convicted for kidnapping Carol DeRanch, one of the only girls to escape him. Bundy escaped from prison twice, the first time for 8 days and the second time for around 2 to 3 months. During both escapes, he killed multiple more women. During all of this, he had a girlfriend, and she suspected nothing for a long time, but after a while, she was a key piece in getting him convicted. Sometime on death row was when Ted met a fan of his, Carol Ann Boone, who he later married Carol, and she had his daughter, Rose. Now I'm going to move on and talk about reliability and validity. So our sources contain very similar content relating to Ted Bundy's life and criminal accusations. This makes them reliable sources because they're all saying the same thing. Also, all of our independent research sources were peer-reviewed studies. And onto validity, they're based on historical events, and the book biography contains multiple sources. And lastly, our independent research articles test what they intended to test and were very clear.
So as we all know by now, after reading the textbook and watching the first ever presentation on antisocial personality disorder, individuals with antisocial personality disorder, or ASPD for short, are manipulative, impulsive, deviant, irresponsible, lack remorse for their actions, and only meet social obligations when it's beneficial to them. The criteria for ASPD in the DSM-5 is a pattern of disregard for and violation of the rights of others since the age of 15, as indicated by 3 or more of the following: failure to obey social norms and laws which can result in criminal arrest, lying, deceitfulness, manipulating or conning others for profit or pleasure, impulsive behavior, irritable and aggressive behavior, usually with physical fights, disregards the safety of self or others, constantly irresponsible with a failure for consistent work behavior, and lack of remorse. The individual must also be at least 18. There must be evidence of a conduct disorder before age 15, and the antisocial behavior does not occur during schizophrenia or bipolar disorder. When looking at Ted Bundy, we can see some of these antisocial traits in childhood, adolescence, and in adulthood. I mentioned the criteria from the DSM-5 specifically so that we can relate it back to Ted Bundy and see how he fits the criteria. During his childhood, as young as a toddler, his aunt said that he placed knives where she slept. Then, when he was a Boy Scout, he hit a Boy Scout on the head with a stick and also liked to scare people. He would put stakes inside the ground and cover them up, resulting in one girl hurting herself. This already is showing behavior that is aggressive. Then, as Ted Bundy started his adolescence, his deviant and criminal side started to show even more. As was already talked about, he was known as Peeping Tom, so he would look through neighbors' windows to try and see women undress. He was also arrested twice because he was suspected of burglary and auto theft. He would masturbate inside closets at his school. He also struggled to make friendships when he was young, and it wasn't even until university where he got his first girlfriend. Now, this first girlfriend that he had in university eventually broke his heart. She stated that some of the reasons she broke up with him was because he was immature, he lacked ambition, and he had a struggling academic situation. What was also notable was that his future victims all resembled this first girlfriend. As Ted Bundy started getting older and moving into adulthood, he started committing his murders. The way he committed these murders can show his ASPD as well. His charming and manipulative behaviors were seen when he would lure women to his car by faking an injury. Also, everyone who met him also said he was very charming. When looking at the risk factors for the development of ASPD, environmental factors such as family environment seems to have a big impact. Parental rejection, abuse, and neglect are all associated with antisocial behavior later in life. The abuse that these individuals endure increases their vulnerability to have maladaptive strategies to cope with their negative emotions such as anxiety and depression. Some of these maladaptive strategies include being impulsive and aggressive. There is also evidence that families that don't provide proper supportive and consistent environments for the child also result in maladaptive coping strategies. When we look at Ted Bundy's life, we can see that he lived a very difficult life. His mother gave birth to him out of wedlock, so he grew up believing that his mother was his sister and that his grandparents were his parents. He also didn't know who his father was. This already, even at such a young age, is showing characteristics of a poor family environment and structure. While Ted Bundy was in this family environment, his grandfather Samuel was very abusive and violent towards him. He said that he was a bully, a bigot, a racist, and that he may have had a mental illness. This information was also corroborated by other members of the family. His grandmother, Eleanor, also had mental health issues, including depression, and she actually did electroconvulsive therapy for her depression. Considering the fact that she had depression, we can hypothesize that she may have not been fully there for Ted Bundy, especially when he was getting abused by his grandfather. We can see here that Ted Bundy grew up in an abusive home, which could have influenced his development of ASPD. In fact, in a study done by Vaughn and colleagues, more antisocial men had a paternal lineage with behavioral problems than a maternal lineage, which is consistent with Ted Bundy's life, considering it was his grandfather who was abusive, and he was his supposed father at the time. There are also different accounts as to when and how he learned the truth about his birth, but this could have caused him to feel unloved. It has been said that antisocial behavior can be an attempt for the individual to cope with this hurt and anger associated with the self structure. Depending on when he found out about his birth could have been a big factor that attributed to his development of antisocial behavior. If we look at Ted Bundy a bit more in depth, we can describe him as an individual with ASPD and psychopathy. According to the textbook, the term psychopath is used for individuals with ASPD who commit horrific crimes. Cleckley described these individuals as charming, but that they lack remorse, shame, guilt, and sincerity. This may be why it is so easy for these individuals to violate social norms and cause harm to others without any feelings of regret. These individuals are usually good at manipulating others and would rather have superficial relationships as opposed to close ones. When looking at a psychopathic serial killer, such as Ted Bundy, it is evident that they have not attained emotional maturity, so they are unable to deal with any fantasies that include violent or sadistic thoughts in appropriate ways. They start to be sexually gratified by deviant means, which may include voyeurism and indecent exposure. Their sexual impulses and need to control may start to grow even more and lead to torture, rape, and murder. The antisocial personality disorder allows these individuals to feel no remorse for the victim. This can be seen in a quote by Ted Bundy, who said, "I just like to kill. I wanted to kill." It is clear here that he had no remorse for his victims, and as he just wanted to keep killing. He didn't care that they got hurt as long as it satisfied his needs. Some serial killers may even look for victims that remind them of someone from their past who angered them and want revenge against them. For Ted Bundy, this person may have been the first girlfriend that he had, considering that she was the first one to break his heart, and most of his victims resembled her in the sense that they had long dark hair parted in the middle, and he even tended to go for different college girls, which is where he met his first girlfriend. In this slide, I have a picture of Ted Bundy's first girlfriend and a few of his victims so that you can kind of see a comparison. However, it is important to note that not all individuals with ASPD will also have psychopathy. In order to look at this, it's important to look at the biological component of individuals with ASPD and ASPD along with psychopathy, specifically in the brain. In a study done by Gregory and colleagues, they looked at whether there was a difference in the brain in individuals with ASPD and psychopathy and individuals with only ASPD, as well as healthy individuals. They took a sample of 66 men between 20 and 50 years old. In order for the participants to be in the ASPD and psychopathy group, they must have had a history of violent crimes such as murder and rape, English as their first language, a reading level of at least 10 years of age, met the criteria for ASPD, as well as scored a high score on the Psychopathy Checklist Revised, or the PCLR. The PCLR is an interview that has 20 items according to an individual's lifestyle functioning. It is split into two factors. Factor 1 looks at interpersonal and emotional functions, which includes characteristics such as selfishness, callousness, grandiosity, lack of shame, and remorse. Factor 2 looks at the antisocial lifestyle, so things related to the deviant lifestyle as well as how impulsive and sensation-seeking they are. Individuals who were in just the ASPD group must have met all of the same criteria except scored a low score on the PCLR. There were also individuals in the healthy group with no history of criminal offenses or ASPD. These individuals all went through an MRI to look at their brain structure. What they found was that individuals with ASPD and psychopathy had much lower gray matter volumes in the anterior rostral prefrontal cortex and temporal lobes compared to individuals with only ASPD and the healthy individuals. What was also interesting was that individuals with only ASPD had similar gray matter volumes as the healthy individuals. Now, without getting into too much detail, this reduced gray matter volume may affect areas that have to do with moral reasoning, processing emotions such as guilt and embarrassment, which may contribute to why individuals with ASPD and psychopathy, such as Ted Bundy, act the way they do. This study shows that individuals with only ASPD are very similar to individuals without ASPD in terms of their brain structure, and that where the brain differs is when individuals have ASPD and psychopathy. So just here are the graphs from the study, just to show that individuals with ASPD plus psychopathy are much lower in both of them. And then you can see how healthy individuals and individuals with only ASPD are very similar. And then here is a picture of the MRI done, and it shows the different brain areas where the gray matter is reduced in individuals with ASPD and psychopathy. Now, there is controversial evidence as to the origins and development of psychopathy. Some propose that individuals are born with the negative interpersonal and affective features of psychopathy, and that the antisocial part that's embedded in psychopathy is more influenced by the environmental risk factors, such as the family and the parental abuse that I described before. Others propose that childhood interpersonal trauma, such as child abuse, can influence the development of psychopathy. To look into this more, Chimenti and colleagues looked at violent offenders and how their childhood experiences related to their psychopathic traits. They recruited 78 inmates between 20 and 71 years old who had all committed violent crimes. They were administered the PCLR test like in the previous study and the traumatic experience checklist to look at emotional, physical, and sexual abuse in their childhood. 64% of the inmates experienced either emotional, physical, and sexual abuse, 22% experienced two types of abuse, and 17% experienced all three abuses, so emotional, physical, and sexual abuse. Most of them experienced emotional abuse, which can be things like humiliation, degradation, and rejection in childhood. The individuals who experienced emotional abuse also had higher PCLR scores. They also found that the other types of abuse, so physical and sexual abuse, were associated with the antisocial part of psychopathy. It's important to note that emotional abuse is different from parental neglect because they are committing an abuse instead of actively neglecting their care. If we can think back to Ted Bundy, we know that his grandfather was abusive both emotionally and physically. Ted Bundy said that his grandfather was violent towards him and that he was a bully. Without knowing exactly what he would say to him, we can see that his grandfather may have said degrading things to him, which is why he labeled him as a bully. Also, the act of being born out of wedlock and his mom being embarrassed to have him, so his grandparents took care of him, shows how he may have felt rejected. Since this study found that emotional abuse was linked with higher PCLR scores, then we may be able to speculate and combine the previous study that I mentioned and say that individuals may be born with psychopathy, but that childhood abuse experience also contributes to the development of it, but more research needs to be done. So, just to recap everything, we can see that Ted Bundy not only struggled with ASPD, but also psychopathy. He could have been born with the negative traits of psychopathy, but his negative and abusive family also allowed for the development of ASPD and psychopathy.
To start off, I will be discussing Freud's psychosexual stages and how it impacts personality, the structural model, id, ego, superego, and defense mechanisms. While we dive into analyzing Ted Bundy through the psychoanalytic theory, keep in mind these 5 core assumptions. Number 1, the unconscious is one of the most powerful effects on behavior and emotion. Number 2, no behavior is without cause and is therefore determined. Number 3, childhood experiences greatly affect emotion and behavior as adults. Number 4, the id, ego, and superego make up personality. And number 5, various conflicts throughout childhood development shape overall personality. Freud's psychosexual stages consist of the oral stage, which is from birth to 1 year, the anal stage, 1 to 3 years, phallic stage, 3 to 6 years, latent stage, 6 to puberty, and genital stage, puberty to death. Each stage of development is marked by conflicts that can help build growth or stifle development, depending upon how they are resolved. So, how does this relate to Ted Bundy? Through the anal to early phallic stages of Ted's life, he was said to have been physically or psychologically abused. Ted's grandfather has been described as the owner of a raging temper. His violent acts touched everyone from cats and dogs to employees and family members. This resulted in an affected ability for introjection or the superego to develop successfully. The lack of superego results in a dominant id, which is focused on satisfying needs. An individual with an overly dominant id might become impulsive, uncontrollable, or even a criminal. Such an individual acts upon their most basic urges with no concern for whether their behavior is appropriate, acceptable, or legal. At the genital stage, it is the time of adolescent sexual experiment. Adolescents direct their sexual urges onto opposite sex peers, with the primary focus of pleasure being the genitals. Ted became extremely into pornography at this time. It then transitioned into violent pornography. It later resulted in him chasing the satisfaction and high. So, from observing Ted's behavior and going off his assumptions that his childhood was perfectly fine, you would assume that his charm and grandiosity were symptoms of narcissistic personality disorder. He embodied perfectionism and sometimes resorted to aggression when he felt belittled or outwitted. Also, in the biography, Conversations with a Killer, the Ted Bundy tapes, a diagnosis of manic depression was given. To assess this, I found a study and that related to the psychodynamic perspective of perfectionism, shame, and aggression in narcissists and their prominence in depressed patients. Next slide. A study conducted by Firmestad et al. Aimed to investigate three objectives: the occurrence of perfectionism, shame, and aggression in patients with NDP, and whether shame is a mediating or moderating factor for aggression. Number two, to explore the associations between perfectionism, shame, and aggression in depressed patients with or without NDP. And number three, to investigate whether shame is a moderating or a mediating factor for expressions of aggression in depressed patients with or without NDP. I'll be focusing only on the first aim. A total of 117 participants were included in the study and were selected from 2 psychiatric outpatient clinics in Denmark. There were 2 groups of patients, 61 diagnosed with depression and NDP, while the remaining 56 were diagnosed with depression and had no personality disorders. All participants were administered the multidimensional perfectionism scale, the internalized shame scale, and the Bus-Perry aggression questionnaire. The results indicate that the narcissistic personality disorder group showed significantly higher scores for self-oriented and socially prescribed for perfectionism, shame, and aggression, which included physical, verbal, anger, and hostility. Shame was found to act as a mediating factor, reducing levels of aggression in patients with perfectionist traits. Now let's address Ted's behavior. His actions seem to always strive to be viewed as grandiose or without imperfections. This is an important note. Contrary to the article, Ted had little to no shame in regards for his actions and inhumane behavior. With better oversight, these traits seen in narcissism are also persistent in antisocial personalities, such as the reputation defending antisocial, which has narcissistic features. Next slide. We can assess the prevalence or absence of perfectionism, shame, and aggression with associated defense mechanisms. For perfectionism, we can interpret Ted's alternate perception of his upbringing as a repressed defense mechanism. Thoughts of his past traumas, such as physical or psychological abuse, are withheld from conscious awareness. Ted often spoke of his feelings of inferiority in his first relationship with Diane Edwards. He also spoke of his disappointment in not being accepted to any of his prestigious law school's choices, but he refrains from acknowledging childhood traumas. We can also see signs of reaction formation, where he gives off a persona of being a well-liked/loved man. For shame, we can speculate use of rationalization, which is apparent in his lack of shame and can be seen in his smiling demeanor to the press during his trial. After Ted's conviction, he began to confess and give details to the gruesome murders that he had committed, including sexual acts and necrophilia. His excuses or rationalization consisted with the blame upon pornography and its effect on part of his actions. For aggression, we can also postulate Ted's use of rationalization. He created an explanation for his behavior after the fact to justify his actions in a way that would be plausible to others. Next slide. Another study, which was conducted by Burgess and colleagues, aimed to explore the behaviors and experiences of sexual murderers in connection with their developmental stages. This was done to assess the entral role of sadistic fantasy and critical cognitive structures that support the act of sexual murder. The study consisted of 36 male sexual murderers. They were up they grew up in the 1940s or 1950s. 33 were white, many were eldest sons, including 4 as only child and 4 adopted. They were of good intelligence, with 29% being average, 36% bright to normal and superior, and 15% were very superior. 80% reported their socioeconomic levels as average or better with two-parent homes. However, problems were noted with parents' backgrounds, such as criminal, psychiatric issues, alcohol abuse, drug abuse, or sexual problems in their histories. 47% of cases reported their father left home before the age of 12. 43% reported that at least one parent was absent before the age of 18. The loss of a father resulted in many of the offenders to adjust to a new father figure. 40% of subjects lived outside of their homes before the age of 18, resulting in instability. Their reports of abuse as children included 13 physical abuse, 23 psychological abuse, and 12 sexually abused. A self-report checklist derived by FBI profilers to understand criminal behavior was used to report internal behaviors, such as thinking patterns, and external behaviors, such as stealing, chronic lying, and assaults to adults. Results indicate that thinking patterns emerged or were influenced by early life experiences, such as abuse. Therefore, fantasizing becomes a relief or a defense that results in a momentary means of having control. Repressed thoughts become retaliatory or vengeful when an individual feels rejected, frustrated, or betrayed. This becomes an important component in the maintenance of the participant's aggressive violent behavior. Because of the importance of childhood experiences and the development in psychoanalytic theory, I'll reiterate the impact of Ted's grandfather being abusive. This is extremely important as it resulted in a series of events leading to Ted's behavior in adulthood. Similar to the men in the article, Ted missed out on a positive role model in normal development of a secure masculine identity and moral sense. Freud mentions this as vital for normal development. Here are some factors that triggered Ted. Ted grew up thinking his grandmother and grandfather were his parents and that his mother was his sister until he realized the truth. Ted's mother moved with him to another state and got married, and she had 4 children. It can be assumed that Ted felt neglected and that this led to him withdrawing and being ultimately developing fantasy as an escape. He also found his birth certificate and saw that the space meant for father was marked as unknown. He didn't get along with his peers. For example, he was teased for a speech impediment. Later in life, he endured a breakup with his girlfriend and was denied access to his preferred law school. These were all struggles with identification. After losing himself, he takes on a powerful image and grows resentful. He eventually reaches his breaking point where fantasy is not enough. The superego isn't strong enough to maintain balance. Therefore, the id takes over for immediate satisfaction and overpowers the superego. Subsequently, a low ego strength results in impulses taking over. Ted satisfies his needs through unconscious processes, and at some point, his maladaptive fantasies become reality, which initiated his first homicide and several immoral behaviors. Now, Ireland will be speaking about Ted Bundy's personality development through attachment.
Hi, so Ted Bundy's personality can be viewed from an attachment theory perspective through his early life attachments. The attachment theory by Bowlby and Ainsworth suggests that there are 4 attachment styles: secure, avoidant, anxious ambivalent, and disorganized. Ted Bundy's personality heavily supports the avoidant attachment style. This attachment often avoids their caregivers and shows no preference for them over strangers. Bowlby says that this style is due to an abusive and/or neglectful parental behavior. What is interesting in Ted Bundy's case is his relationship with his girlfriend Elizabeth Cloper and wife Carol Ann Boone. Avoidantly attached individuals usually struggle with forming intimate relationships, and this is similar to psychopathy. A psychopath such as Ted Bundy would be unable to have real feelings for someone, show empathy, or fall in love. Therefore, anything that might have resembled those things in Bundy's relationships would have been superficial charm. It was later discovered that the women Bundy dated all resembled his victims. Specifically, they were all attractive with long, dark hair. As mentioned, from the psychodynamic perspective of the antisocial personality, some people have a more developed reality principle. This allows them to have what Millen refers to as a mask of sanity in their social circles. This could be how Bundy gets away with appearing like an emotionally responsive partner for so long. Although antisocials are incapable of proper attachment and love, some are better at manipulating others and controlling their impulses. Another cause of attachment issues in the antisocial personality are neglect in early childhood. This is clearly true for Bundy because his mother was so ashamed that she had him that she gave him up to her parents and acted as Ted's sister. This act of neglect and lack of empathetic tenderness is what contributes to Bundy's lack of development of empathy towards others. Now, on the next slide, I will mention some interpersonal factors, such as the fact that violence is often learned from violent family dynamics. Bundy's grandfather was a very aggressive and violent man, often abusing Bundy physically and psychologically. After all, how is a child supposed to learn love, empathy, care, and control of their anger if that was never taught or given to them? Now I will go on to talk about a study titled The Relationship Among Childhood Abuse, Parenting Styles, and Antisocial Personality Disorder Tendency. This study was done by Chen and others in 2011 and is about early family attachment patterns and how that affects later behaviors. They wanted to look at the relationships between childhood abuse, parenting styles, and antisocial personality disorder. There were 350 participants in this study. They used a personality diagnostic questionnaire to screen for ASPD, the Parental Bonding Instrument Childhood Trauma Questionnaire, and Adult Attachment Questionnaire. Researchers found that compared to the controls, those with ASPD experienced less care from their parents, were not encouraged to have behavioral freedom, and were immensely controlled throughout their childhood. They also found that scores of childhood abuse and neglect had a positive correlation with ASPD scores. This meaning that the higher rates of abuse and neglect, the more likely you were to develop ASPD. Specifically, the scores from the attachment questionnaire were significantly related to personality and behavior later in life. Furthermore, physical and psychological abuse from the father, motherhood inverse, emotional abuse, mother refuse, lack of motherly love, and the mother's control were all strong predictors of attachment disorders, behavioral problems, and personality disorders such as ASPD. Therefore, relating it back to Ted Bundy's childhood, his parental attachments, abuse, and neglect are all correlates of why he developed ASPD. The study explicitly states that abuse from the father, or in Bundy's case, his grandfather, negatively affects attachment, behavior, and personality. Next, the study directly states that motherhood inverse, mother refuse, lack of motherly love, and the mother's control are significant factors in attachment and personality development. This is related to Bundy's case because his mother refused to accept him as her son, and thus he was raised by his grandparents with his mother being brought up like a sister. Now on to the next study, titled Clarifying the Associations Between Individual Differences in General Attachment Styles and Psychopathy, is about the common attachment styles of people with antisocial personality disorder. Specifically, how people with ASPD commonly have avoidant or anxious attachment styles. Previously, we mentioned how Ted Bundy presents with an avoidant style, but anxious attachment traits are also common in people with ASPD. Researchers Christian and others in 2017 wanted to analyze the association of individual differences in attachment styles in people presenting with psychopathy. They were interested in this because it had not been clearly looked at before, and attachment theories could provide great insight into the interpersonal relationships and etiology of people with ASPD. There were 541 participants in this study from Australian and American populations. The measures used were the Triarchic Psychopathy Measure, the expanded Levinson Self-Report Psychopathy Scales, the Experiences in Close Relationships Revised General Short Form, and the Attachment Styles Questionnaire. Results of statistical analyses showed that the psychopathy domain of boldness was consistently negatively correlated with insecure attachment styles. The affective domain, including meanness and callousness, was consistently associated with avoidant attachment, and the behavioral domain, including disinhibition and antisocial traits, was consistently associated with insecure attachment styles, specifically more anxious attachment. These findings suggested there are indeed significant and consistent relationships between individual differences, attachment styles, and psychopathy. So how is this related to Bundy is quite clear. From an attachment theory perspective, this study supports the idea that Bundy's personality originates from his earliest attachment styles. These attachments encourage the development of ASPD. Furthermore, Bundy is insecurely attached, predominantly avoidant individual. This attachment style is proven to be a consistent association to psychopathy, as Christian and others prove in their study. Finally, we will conclude with a brief summary of Ted Bundy's personality.
Just to summarize our presentation, the selection of Ted Bundy is due to his interesting, multi-layered, and complex personality. Learning about and analyzing his life from childhood to adulthood gives a perspective of his development. This allows an in-depth observation of nature versus nurture and how they intertwine or are important in the development of personality. Personality theories emphasize childhood impacts such as abuse and neglect to interpret the evolution of Ted's path to being a serial murderer and necrophiliac. Firstly, this is done through speculation and intensive research that result in MRI evidence of innate negative interpersonal and affective features of psychopathy as well as childhood abuse, whereas antisocial personality disorder is influenced by environmental risk factors. Secondly, psychoanalytic theory addresses the dynamic nature of the id, ego, and superego, and the effect imbalance has on Ted's impulsive behavior. And finally, attachment theory conveys the impact of parents' teen styles and the result of insecure avoidant attachment, leading to antisocial personality disorder and the psychopathic diagnosis. Overall, the multifaceted personality of Theodore Ted Bundy can be established as having various links to the maturation of his criminal persona.